Well, I think probably the best example would be to start with major depressive disorder.
Okay.
Certainly one of the most common disorders that is seen in clinical practice. And the way it is defined in DSM-3 through DSM-4 has been that it has 9 criteria that include the depressed mood, the anhedonia or lack of interest, and then a series of both sleep, concentration, somatic concerns, and suicidal ideation that are kind of the bedrock of kind of the DSM-4 definition of major depression. Nowhere in that set of criteria is there any mention of anxiety. And what's of interest is that in the STAR-D study, which is the largest study of major depressive disorders conducted by the NIMH as a clinical trial, more than 50% of individuals with major depression, have substantial anxiety symptoms. Now, the DSM-4 even prohibits you to consider the diagnosis of generalized anxiety disorder if you have major depressive disorder. It's a hierarchy that is left over kind of from the finer criteria and the DSM-3 and so forth. It's been around forever because the idea was that you'd have anxiety disorders which were completely separate from mood disorders. And the idea that patients just don't simply present in this way, that they are usually more than 50% of the time will present with a combination of both mood disorder, say a depressive disorder, and anxiety, is nowhere supported within the DSM-4. And yet it's the most common presentation. So we debated for a long time as to whether or not we should have a kind of a separate category of anxious depression that would be able to characterize these individuals. And the decision was made, what we will do is have a specifier for major depression that would be the anxious distress that will characterize the level of anxiety that an individual with major depression has, to better characterize that individual, and also to alert the clinician that individuals with anxiety, as found in the STAR-D study, actually have a much poorer response to existing antidepressant and cognitive behavior therapies for depression. They also are at far higher risk for suicide. And I think those are the kinds of clinically relevant materials that we wanted to emphasize.